You're tuned in to the Dr. Kinney Show, and I'm your host, Dr. Erin Kinney, a naturopathic doctor and speaker dedicated to unraveling the mysteries of your body and guiding you back into balance. Let's get started. Hey everyone, welcome back to another episode of the Dr. Kinney Show. This week, I'm really pleased to have joining me Kaitlin Barry, who is an occupational therapist and a certified lymphedema therapist. And we're going to have a chat all about the lymphatic system, which is really important. So I'm really glad to have you here on the show, Kaitlin. It's so awesome to have you here.
Thank you. Thank you for having me. I'm excited to be here too.
So let's start. Can you share your story? Like, how did you get into this work?
Sure. Absolutely. So I actually started out as a cardiopulmonary rehab therapist. That's my first career, I guess you would say. And I was working in the hospital and I worked with heart and lung patients, exercising them. Really great time. There was one client in particular who was a gentleman. He was a pastor. So he had this huge arm. It was probably like 7 times the size of his other arm. And for decades, doctors have told him, there's nothing they can do. There's nothing they can do. And this poor guy had to get his suits tailored and everything. So I was talking to one of my colleagues at that time, and she was saying, like, no, I'm pretty sure this is lymphedema. I think there's something that can be done. And the manager, the occupational therapist who was a manager, she was a certified lymphedema therapist. So I coordinated them too. And then curiosity in my part, I was like, what are you doing? What can I do? How can I help? How can I help on my end of things while you're doing your end to really maximize this guy's benefits? And from there, it was just the rest is history. Like, his arm got down to almost the exact same size of his other arm. We all cried. It was life-changing for him and such a great feeling for us to get him there. And then I went to occupational therapy school and knew I want to do this. I want to help those with lymphedema. So that's how I got started.
Cool.
And I'm really appreciative of it.
Yeah, it's really cool. And it's so crazy. Like, I think when you have seen someone's body where their body is just holding on to so much lymphatic fluid. Yes. So before we dive into kind of more about your work, can you give listeners like an overview of the lymphatic system? Let's do like Lymph 101.
Lymph 101. Okay, so you have your lymph nodes. You have 700 to 800 lymph nodes all throughout your body. Oftentimes, like it's part of your immune system. So you'll see like maybe a lymph node in your neck will like flare up or something when you're battling some kind of germs going on. Could be internal, could be environmental. Also can be linked to autoimmune stuff. So I know you've touched on that quite a bit. But the lymphatic system, 700 to 800 lymph nodes all throughout the body. You have one really large lymph node. It's called the cistern chi. It's kind of tucked on your left side, I believe in front of or behind your lung. In front of your lung, behind your lung, on the left side. And it's called the cistern chi. It's like the largest lymph node in your body. Me personally, I call it the queen bee. So when you wake up the queen bee, when you stimulate it, whether it's from diaphragmatic breathing, massage, compression, your whole entire lymphatic system is awake. So it will help the fluid move more freely. Yeah. You have like 10 to 12 liters of lymphatic fluid all the way throughout your body. Yeah. And if you're not moving that fluid or replenishing it with clean, fresh water, then it's going to become like sludge water. It's going to make you feel bogged down, foggy-brained, really run down.
Yeah, well, because one of the lymphatic's main jobs is detoxing your body,
exactly.
Right? It's got, obviously you talked about, like touched on the immune system a little bit. It's where all your dead white blood cells go, right? They go and they hang out in the lymph nodes and the body has to clear them out. But it's also how your body gets rid of waste. And it's how your body gets rid of fat cells too, right?
Exactly.
So it's really hard to lose weight if your lymphatic system is sluggish. It's hard for your body to do a lot of things if the lymphatic system is sluggish.
Yeah, the lymphatic system's like your unsung hero.
Yes.
It does so much for the body.
Yeah.
And when you have that sludge water, when you take in fresh, clean water, you're like thinning the viscosity of that protein-rich lymphatic fluid. And when you're thinning that viscosity, the fluid flows much more freely, and then you're excreting it. Yeah. And then you have like that nice clean water so that way you feel lightweight. And
yeah. So talking about hydration, right? You need to make sure you're drinking plenty of water.
Exactly.
And this is why when you go get a massage, always like drink plenty of water, because aren't they opening up some of these?
Well, it depends on the massage. Definitely for lymphatic massage. Deep tissue is a whole different scope of things. But with lymphatic massage, definitely make sure you drink plenty of water beforehand and afterwards, because you're going to be going to the bathroom quite a bit.
Yes. Yeah, because after the lymphatic fluid, I always explain, I'm like, your lymphatic fluid, the lymph tissue goes and it meets the like the capillaries, right? And it's going to pull all the stuff from the bloodstream that the body wants to get rid of.
Exactly.
But then it's got to like come all the way up. And where is it? Comes up to the 2 main lymph ducts, right? Aren't there
so
two big ones up here? So it's going to come up
to your terminus.
Okay.
So when you're doing lymphatic massage, ideally you're supposed to wake up that queen bee first, because the queen's awake, beehive, worker bees are going to go to work. And then you're going to open up the terminus. You want to wake up the abdominal area, the queen bee first, and then you're going to go to your clavicle area, and you're going to just gently light massage. And lymphatic massage is like feather light.
Yeah.
So because majority of the lymphatic system is so close to the skin, yes, you have deeper lymph nodes, but majority of it is close. A third of your lymphatics are in your gut. So gut health is very,
so
very important.
Yeah.
So I can't stress that enough.
Yeah, which we've done. If you're interested in learning about gut health, we've done a lot of episodes on that, so you can go listen there.
Yeah.
Okay, so you open up here.
Yep.
And then what happens next?
So then it goes down through the thoracic duct. So you have your vascular system, and then you have your lymphatic system. The way I describe it is the vascular system, your blood system, you have channels all throughout your body. There's valves, and you have a pump, which is your heart. The lymphatic system is pretty much the exact same setup all throughout your body. There's tracks, there's valves, there's no pump. So it's like automatic car windows with your vascular system and your manual windows that you have to pump that fluid out. And by doing that, you do lymphatic massage, you wear compression, nutritional strategies are really important.
And exercise is really important too. You think your muscles act a lot as that pump, as you said, right? Because a lot of the pump, it's happening like where the capillaries meet the lymphatic vessel, right? Yep. It's happening like and you said that's close to the surface typically, like in the so moving your body, drinking water, kind of all the basics, right?
Yep. Exactly. Yeah.
Skincare
is huge too.
What'd you say?
Skincare.
Oh,
making sure your skin is hydrated, because if you're moving fluid, especially if you have an edematous side like lymphedema, you want to make sure that when you're moving that fluid, you're moving that fluid away. And what happens when you move fluid away? It's like a desert; it becomes dry. Because you don't have as much fluid. So you're moving that away, so you want to make sure the skin's hydrated too.
So just hydrating topically, you mean?
Topically
not internally.
And internally with
so
water.
Both ways. So what are you recommending as the topical hydration?
I go on the hippy dippy side of things.
Yeah.
So I like this one brand. It's called Yoro Honey Manuka cream.
Oh, it's got Manuka honey in it.
Oh, yeah.
Nice.
Yeah. There's like 5 ingredients. They're all organic. You could probably eat it. Not that I advise that. But it's very clean. So whatever we put on our skin is going to get into our body.
And into your lymphatic system. Which we don't want to bog that down. Which that brings up an interesting point. You know, I think I've got a bunch of tween kids in my house, and, you know, they constantly love the Bath & Body Works and all these scents and all this stuff. And I'm constantly sitting them down. I'm like, okay, girls, we can't put too many things on it. You're going to give yourself acne. We're going to mess up your hormones. Yeah. But it's also going to affect their lymphatic system. So that everything you put on your body gets into your body actually faster than when you eat it.
It's your biggest organ,
which is
skin.
Terrifying.
Yeah. So, kind of crazy, isn't it?
So I think, everyone should be using the hippy dippy. So look at what you're putting on your skin.
Exactly.
And this goes for makeup. It goes for clean anything that's touching your skin, right? And again, these things are going to have a major impact on your lymphatic system. So if you're struggling with lymph health, good to take inventory of what's going on in your skin. Right?
Exactly.
So making sure it's hydrated, but also making sure you're hydrating with the right products.
Exactly.
Yeah.
Exactly. I also make an in-house blend that I use on my patients. And I call it my Lymph Flow Serum.
Oh, nice.
And I have my Glow Serum too. And it's essential oils and either fractionated coconut oil that's 100% pure or jojoba oil.
Yeah.
So depending on what part of the body that we're working.
And is that what you're using when you're doing the lymphatic massage?
So I will ideally, you want skin to skin. You don't want any lotions or anything like that. But if somebody's really dry, I would definitely use that, either incorporate it, because you don't want, with the massage, it's kind of like a skin stretch and release. You want it light. You don't want to just be brushing it to where you're not moving the skin, because then it's kind of like womp womp. But you want a nice little skin stretch and release. And it's a very slow and very rhythmic movement. So when doing that, even after the massage, I'll definitely make sure I put my stuff on them to really hydrate the skin.
Yeah.
Yeah.
So let's talk a little bit about things that happen in life that can impact the lymphatic system. Yeah. I know you work with a lot of oncology patients, so obviously cancer, but surgeries, right? So tell me about some things tell us about some things that do have a major impact that might warrant getting a regular lymphatic massage.
Sure. So there's 2 types of lymphedema. There's your congenital, there's type 1, there's primary lymphedema, you're born with it, due to a malformation of the lymphatic system, so forth, stuff like that. Then there's your secondary, which is those clients who will have like a breast oncology. It could have a traumatic event to the lymphatic system, basically. So any kind of surgery. It could be like a knee surgery. I've got a lot of like lower legs. They have a knee. C-section.
Yeah.
A lot of that. there's radiation. So you have radiation or any like traumatic event. I've had
car accident.
Yeah. As somebody like that fell out of a 2-story building.
Oh, wow.
Yeah. So that's really traumatic. So
Yeah.
things like that can set it off, I guess you would say. So any kind of impact to the lymphatic system.
And when you're having surgery, you think about, they're cutting through a lot of the lymph vessels. You're also cutting through the fascia, which holds a lot of the lymphatic system. So you cut through that, then it's hard for things to flow.
Exactly.
So your job is to help make sure that, if you've been through that trauma, to get it going again, right?
Yep. And rerouting it. So your lymph tracts will regenerate.
That's
your
cool.
lymph nodes do not regenerate. So once you take a lymph node out, let's say there's a breast cancer person, they take 1 or 2 lymph nodes. Those tracts kind of regenerate over time.
Cool.
But that node will not come back.
Yeah.
So it's help rerouting it. And then being a certified lymphedema therapist, knowing the watersheds and pathways to safely move that fluid, so then you're not over inundating an area that
doesn't have can't get things out.
Exactly.
So that's kind of, it's okay, someone comes in, let's say they've had lymph nodes and breast surgery, you'd want to go and be okay, we got to move this lymph's got to go somewhere else.
Yep.
Is that, that's cool.
Yeah.
It's so amazing. I love hearing about when the body, you're oh yeah, we took this out, but then the body's going to regenerate that. Yeah. I think it's good to hear that if you're someone who has had surgery of any kind, know that your body's going to find a workaround here.
Yes.
But it can be helpful to work with someone like you to speed that up a little bit.
Absolutely. And for those that have surgery, you optimize the healing process.
Yeah.
So that 2 week to 2 months following any procedure, it doesn't have to be a breast reconstruction or anything like that. Any procedure, you want to work with a certified lymphedema therapist to optimize that healing, because even aesthetics.
Yeah.
So people going for aesthetic procedures, a lot of research is showing now getting you in a week or 2 before the procedure, because you're detoxing your system, you're moving those toxins out and about.
Yeah.
But you're also boosting that leukocytes, which is going to help you heal faster afterwards.
Yeah.
So it's preparing the body beforehand, going for the procedure, and then afterwards you have a couple of sessions.
Yeah, it's pretty wild. I actually had breast surgery a couple years ago. I had to have a mass removed, and then I got an implant put in to kind of cover the mass. And it's so crazy how much fluid your body, for the first couple of weeks, obviously you're healing, so you keep all this fluid here, and that can make it so much more painful, right?
Yeah, absolutely.
All the swelling and everything. But I did what you said. I had a lymph massage a week before surgery, and then I had a couple, and it was crazy how much swelling would go down immediately, right? Exactly. And it's such an interesting experience for those of you who haven't had a lymphatic massage. You go in there, and if you're used to regular massage, you're wait, they're barely touching me. What's happening? Is this going to do anything? But then you have to pee a ton because it's flushing it out through the kidneys, and your body looks visibly different. Yeah, absolutely. Which is really, I think it's so cool.
It's amazing.
Yeah,
it's the unsung hero. I feel of your body. The lymphatic system.
Yeah, it really is the unsung hero. And it's not really talked a lot about in Western medicine.
It's not.
And, in my work, I deal with a lot of patients with Lyme or chronic infections, and the chronic infections will really take a toll on the lymphatic system as well. Because remember earlier we talked about how that your lymph nodes carry around your dead white blood cells. They send them out and then they come back, and those can clog it up. So if you've got an infection and you're tired and you're not moving, maybe you're not drinking enough water, you're not feeding your body what it needs, you're going to get stagnation in your lymphatic system. So, you don't have to have had trauma or surgery or breast cancer or anything like that to have, to need this, right?
Exactly. No, you don't. Anybody can have a lymphatic massage. Yeah. Yeah. As long as you don't have acute blood clots. Yeah.
What are the contraindications for?
So if you have acute blood clots, IBS, if you have active cancer, there's mixed reviews in research if you should
you don't
or
want to
shouldn't.
Move things around, maybe.
I err on the side of caution. I don't.
Yeah.
I wait until I'm cleared.
After. Yeah.
Those are the really big ones.
Got it. How about pregnancy?
Pregnancy, you can get a lymphatic massage, not in the first trimester.
Yeah, that's pretty standard.
Make sure you're cleared by your OB/GYN for the second and third.
But that can be really helpful for symptoms, because sometimes in pregnancy, you hold on to so much fluid because the body's wait, I have all this extra fluid. What do I do with it? Yeah. But I'm sure that can provide so much relief for patients.
Yeah, the massage, and then even getting compression on them too.
Yeah. So let's dive into it. I know you brought some things. Let's dive into some of the compression items and things you can do in between lymphatic massages, right?
Exactly. So what I do with my clients is not only do I do the massage as an occupational therapist, I train them how to do the massage that's specific for them and their body. So massage is one part of the complete decongestive care is what it's called. And then the other components would be compression, exercise, skincare, and then I also do nutrition because food is medicine too.
Yes.
So the compression part of things, so I have a couple garments here that I brought in. This one in particular, we'll start with the legs. This looks like a warm, wintry sock. It's new to me. It's been around since 2020. It's great for nighttime use, and you can see it is stretchy. It's gradient compression.
It looks like a leg warmer.
It looks like a leg warmer.
It's like a leg warmer that goes underneath. Yeah, or a sock that's missing the toes.
Yeah, it's a sock that's like missing the toes. This one comes all the way up to the calf. You can get them all the way up to the thigh. And it has like these channels in it, basically how it's stitched, I guess you would say. And it has amazing impact on somebody with swelling. Yeah. So even if it's like fibrotic tissue, that's going to help break up that fibrotic tissue.
So you would recommend these for someone who's having like major lymphedema in the legs, correct? Is that what these compression socks you?
Yep.
Okay.
So if you notice that you're waking up in the morning and you're still swollen, because sometimes people, their legs will get swollen as the day goes on, they go to bed, they wake up, and
they're fine.
Their legs are better.
Yeah.
So that's what I call creep flow at night.
Got it.
So they're in like the early stages.
So they wake up in the morning and their ankles are still puffy. So maybe someone who's pregnant might experience this, or if you're experiencing this and you're not pregnant, these would be a great thing.
Yeah, that's great for
also,
nighttime.
I feel like high socks are so in style now. These
might
be stylish to wear around with your shoes, right?
They be nice and cozy in the wintertime.
Yeah.
This one that I have here is called a flat knit. It's different stitching. It feels like it's a little bit thicker, but it's not. It's actually really has a cooling effect on how they stitch it, but there's like a little forgiving area in the elbow so it won't rub. And this is custom. So this is great for somebody who is decongested all the way, but an over-the-counter because of the curvatures in the arm.
So this is for the arm.
This one's for the arm. Yeah,
Got it.
This one's for the arm. It goes from the wrist all the way up to kind of like where your armpit would be. A lot of breast oncology patients will use this. It feels very soft.
Yeah, because that's where you'll tend to see if you've had lymph nodes removed in the armpit, you might see a lot of swelling in the arms, correct?
Yep. And then even if you have a surgery and stuff, wearing matches your outfit. Yeah. Not everybody. Let's see. How do I want to say this? Wearing compression, low grade compression after having a breast oncology surgeon is not a bad idea because there's a study out, clinically proven, that if you exercise while wearing compression after having breast cancer, the procedure and everything, it reduces your risk for lymphedema by 70%.
Wow.
That's huge.
That's a huge reduction.
It's huge.
So this is even before it starts.
Even
you
before
would wear
it starts,
this
you have no
as
signs
a
and
prevention.
symptoms.
Okay.
There's normally be like an over-the-counter compression sleeve. This one that I have
Again, you
here,
said this is custom made.
This is custom made. So this is for somebody who has extra curvature or extra firmness in their skin, where the over-the-counter would not be the best style garment.
Yeah.
So compression, yes, is key, but also finding the best compression
for you.
Because if it's not the best option for you, then it could do more harm than good.
I gotcha.
So,
and where would someone get a custom made? They would work with someone like you?
They would work with someone like me,
Gotcha.
certified lymphedema therapist.
Cool. Okay. And you kind of measure them and figure it out.
Measure that. I do the whole decongestion. We get them all the way down to where we hit baseline, whether it's the same size as the other arm or their new normal. And then that's when we get that custom compression sleeve.
Cool.
Yeah. And then other ones I have here, these compression bras, because compression bras after.
Oh, yeah. I remember wearing those for several months after
my
surgery.
Yes.
Yeah. So stylish.
This one is Prairie Wear. I love them. They're so soft. And there's no seams.
What was it called?
Prairie Wear.
Prairie Wear. Okay.
So ideally, this one, I call it the vest. It's functional.
Oh, it's a vest.
Well, yeah,
it's not a weighted vest this time, guys.
It's not weighted. This is compressed.
It's a compression vest.
And it's like a nice, gentle hug. I actually will wear this sometimes.
Just wear it in general.
You can wear it in general. Yeah, it just feels good. It's just like a nice little gentle hug. It comes all the way up into the axillary region, so it reduces your risk for seromas after a procedure. So this is the one that we were right after surgery. So it's like I call it my functional bra, not my fashionable bra.
Got it. Yeah. All right.
But after you get past a certain timeline wearing that bra, then you can advance to the other different styles. One of them is when you're really, really in remission, I guess you would say. This one's like a sports bra. Yeah. So it has a cute little backing and everything.
Very nice.
And this is lower cut, but it has high compression.
Got it.
So I actually have one.
And most of the compression is going to be on the breasts themselves, or is it around?
All 360.
All 360.
360. Okay. Yep.
Awesome.
I want to feel that one.
Very cool. That's very nice.
And then I have 2 pant legs. And these are over-the-counter ones.
Okay.
So this is great for anybody with swelling due to pregnancy. They could have initial beginning stages of lymphedema or lipedema. Lipedema is a whole different story, so we'll get into
We'll bring
that.
you back for another episode on that one.
We'll do another episode on that one. But these are elastic athletic. Yeah. And they have these little massagers
cool.
in the fabric.
Yeah.
and it helps with lymphatic drainage. So it's like getting a lymphatic massage while you're working out.
Oh, while you're working out.
While you're
That's
working
amazing.
out, while you're walking. I mean, I love these. I
Yeah.
have a couple pairs in a couple different colors. Not going to lie.
Yeah, they look great. They look just like regular yoga pants.
They look like regular yoga pants, and they're gradient compression.
Yeah. What's price point on a pair of pants like these?
So it depends on the company. This one, it depends on the style. There's different styles that they have as well, but I think they range from like upper 90s, low 100s.
Oh, so it's about
all
the
way
same
up to
cost
like
as
almost 2.
a regular pair of Lululemon pants.
Yeah, exactly. Yeah.
So would you advise people that are just like, hey, I want to do some good things for my lymphatic system that they can wear those a couple times a week?
Yeah.
Yeah?
Yeah. Yeah.
Cool.
Yeah. They're great. I mean, no one will know.
Yeah, no one will know.
No one will know.
Yeah.
They look
or
like
they might want to know. You could say
Yeah.
like, hey, I'm doing good things for my lymphatic system while I'm in yoga.
Yeah.
I mean, exercise is also good for your lymphatic system,
is.
right? But you could give it like a double.
It's like a 1-2 punch.
Yeah.
It's like a combo.
Yeah. Okay, so I have a question. We're talking about these bras and wearing them for obviously lymphatic support. What's your take on like bras in general? Do they impede your lymphatic flow if you're wearing a bra? Like if let's say you're not a cancer survivor, you don't have like is wearing a bra in general hurting women and their lymphatic system?
Yes, but no.
Yes, but no. Okay.
Yes, but no. I think it all
Elaborate
depends on
on
the
that.
bra. I think
Got
it depends
it.
on the bra. So
Okay.
like wire bras.
Yeah, wire bars are going to be no good.
Yeah, because you're going to just think of if you don't have. If you have that wire, it's going to compress into your skin. If you have some kind of like indentation, that's your lymphatic system is so close to your skin, that's going to disrupt the flow.
That right there.
So you
in
might
that
get
area.
like a little like pucker bump.
Yeah.
And then eventually it'll go away.
Yeah.
When you take your bra off at the end of the day, if you have wires.
But if you're wearing that all day, it's impeding the flow in that area, correct?
Yep.
Okay.
It can. It
So not great to wear wire bras.
Not great to wear wire bras.
Yeah, and definitely not good to sleep in a bra, correct?
No.
Yeah. Unless you're in a post-op situation.
Post-op
where,
situation, yes.
Yeah, where you're trying to reduce.
But like an average person on the street, no other medical, I wouldn't advise sleeping in a bra.
Sleeping in a bra.
You want things to flow naturally.
Yeah,
Get
I mean,
that
probably
pre-flow,
better
get up
to-
to that thoracic duct. And
yeah,
get it
and
out.
yeah, because if you're keeping everything too compressed all the time, it's not going to be great.
Yeah.
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 It's interesting. I had a conversation with a colleague, I don't know, it was probably a couple of years ago. She's a naturopath in Connecticut, and she does a lot of lymphatic drainage internally with like homeopathic remedies and whatnot. And we were just talking. She's like, I think bras are the devil. I think we need to go back to the hippie era where women don't wear bras. And
Yeah.
and
Let
she
it
does
be
a lot of
free.
like thermoscan, the thermography. And she's like, I notice on my women that wear, the underwear or bras that she's like, I see more heat spots in those areas, which I thought was really interesting.
Yeah, that makes sense.
Yeah.
because it's disrupting that flow.
Yeah, you just want to
Yeah,
keep
having
things,
all those toxins
keep
being
things
blocked out.
flowing. I think that's just a message for all things. You want things to be moving.
Yeah.
We don't want
Think of
things
it like
stagnant
if
in
you
the
were
body.
like driving down like, I don't know, 97 or something, and like part of the road, there's like a roadblock or something.
Yeah. Yeah,
Think of how
then-
the traffic backs
Oh,
up.
the traffic backs up, and then you got
Yeah.
fluid built up here and built up there.
And then
and-
you're going to feel, ugh.
yeah.
You're gonna feel,
Well, and you think, I get so many women that come in, they're like, oh, I just feel puffy and my face feels puffy and I look at pictures and I look bloated. And, a lot of that is lymphatic fluid,
It is.
right?
Yeah.
And, we haven't even touched on this much today, but your hormones will also have an impact on your lymph. Maybe you want to touch on that a little bit?
huge. Yeah, there's you're the expert with the hormones. I'm gonna let you talk about it.
Yeah, I mean, so your body has receptors for estrogen, progesterone, testosterone all over the body, and when particularly progesterone, if progesterone's a little bit high or if it's a little bit low, it can upset the fluid balance in general, and so things aren't going to move. But if you're not detoxing your hormones, because say your liver is too busy detoxing alcohol or any other toxins, that's going to cause a backup of lymphatic fluid. So and this oftentimes when women go through menopause and we start to see a major we stop getting a period. We've been talking about like going with the flow.
Yeah.
Your period is a flow that like gets things out. So when that stops, the body is like, whoa, what's happening? I got to figure out. It's actually really important to work on your lymphatic health in that menopause time.
Yeah.
Because the lymphatic system is going to have a lot more pressure on it just because there isn't as much coming out. So, for my menopausal patients or even perimenopause, we talk a lot about, hey, let's make sure we're getting your lymph moving. Mm-hmm. This is where exercise is so important. Drinking water, all the things we've talked about. Yeah. What else was I going to say? But yeah, when that period stops, it really does affect the whole system.
It does. Yeah. There's and like another way you can support it is like dry brushing.
Yes. Oh yeah, we didn't touch on that. Yeah.
Yeah, dry brushing is another great way to help support it too.
Yeah. Well, can you talk about dry brushing in general?
Sure. What do you want me to talk about?
Or just give an overview of it.
An overview? Okay. So dry brushing, there's all different types. I in particular have one dry brush that I really love right here.
Oh,
For
yeah.
those that can, you can grab that one if you want. It's really soft.
Cool.
This is really, really soft. Name brand
this feels
is
really
Cicely
nice.
Braden. It's like velvet almost for your skin.
And so you're always going towards the heart, correct?
Depends.
Oh, depends. Okay.
It depends. So short answer, Potentially.
Yes.
So it all depends on your body and what your body has gone through. So if we don't want to redirect it that way, we shouldn't redirect that way.
Yeah.
So, but if we're getting like swelling in our arm, we might want to come across our chest or go down to our hip.
So this is the type of thing where if you've had surgery, you've had something major in your body, you would want to work with a certified lymphedema therapist so they can instruct you, hey, here's what you can do at home. You talked about like giving your clients the home care piece. So I think, you can look up dry brushing on the internet and there's, usually there's like a pattern that you would do.
There's a certain sequence. There are sequences for different parts of the body. There's different techniques. So with the dry brush that I brought in today, it has a nice curvature to it. The bristles are like velvety soft. And it has like these little like bumps on the bristles. And those bumps, it's designed, it's called the lymph brush. And those bristles are designed to kind of like pull the skin and release. And there's different movements that you can do with this brush. So when you're doing a lymphatic massage, you're doing not just sweeping, you're doing like rotation techniques. There's different techniques you can do, and it's very transferable to how to use it to this.
Because some of the dry brushes, they're uncomfortable,
hard and
they don't hurt.
bristly,
Yeah, they don't feel very good.
They're really best for moving circulation
I gotcha.
and skincare.
Yeah.
So moving the dead cells off the skin. So that's what those are really good for. This is the lymph brush.
Yeah.
So it's designed for your lymphatic system.
And
there's two different sizes.
Cecily Braden is the name?
Yeah, I have a link if you want.
Cool.
Yep.
Yeah, we'll put it in the show notes.
I'll share it with you. But there's two different sizes. There's one for your face, so you can do like contouring for like your face and everything,
very nice.
and move the lymphatic if you feel like congested.
Which is great to do after travel or
Travel,
partying
before
or,
travel.
Yeah.
You could do it every morning.
Yeah.
I incorporate it in my every morning routine.
Nice.
So it helps with sinus congestion, brain fog, headache, migraine, stress.
All the things.
All the things that can make you feel bloated, swollen, and everything like that. And then there's a larger one that's the body brush. I'll even use these during my facial lymphatic drainage sessions with my clients, and I'll use a combination of the body and the face brush on the face. Just doing different things, because you can come behind like the head and the scalp, because you also have your lymphatic system in your brain that's connected to your lymphatic system.
Can you access the lymphatic system? You can? Like there's...
you got lymph nodes I think the only place you don't have lymph nodes, I think, are your eyeball.
Yeah, there's none in your eyeball.
Yeah.
But most of the lymphatic, isn't that inside the brain, underneath the skull?
It is, but you're still stimulating.
Oh, you're still stimulating when you go
fluid.
work on the scalp.
Like, there's a lot of new upcoming research coming out for like Parkinson's, Alzheimer's, helping moving that fluid in the brain out, and people are thinking more clearly.
Yeah.
Long haul COVID.
Yeah.
I get a lot of those clients in too.
Well, that's, a lot of the infection stuff just clogs up those lymph nodes, and if there's no flow, the body doesn't work how it's supposed to work.
Yeah.
That's really interesting about the Parkinson's patients.
Yeah. I have a couple that have come in for that, and we see progress, which is really great. It's so much because you're connected to the nervous system too. You're also calming that nervous system, because you also have that vagus nerve that will go down to your gut, and then looping back to 360 gut health. How important that is.
Well, that's what a practice like this. This thing feels amazing.
Right?
Like
who
wouldn't
want to use this every day?
Yeah, you're like, oh, this feels great. I think it'd be nice to do on your kids too. Right? They might like. Awesome. Okay, what else? What else do you want to talk about?
Oh gosh, I don't know. I could be here all day, so you might need to create a series.
Yeah, well, I think we should have you come back and talk about lipedema, because I think it's a separate thing.
Just a little short intro to lipedema. Lipedema is connective tissue disorder. They link it to a majority of women. 97% women, 11% of cases in the U.S. I would say it's vastly underdiagnosed. A lot of people get it confused with cellulite. It's known as the painful fat disorder. Cellulite fat's not painful.
Yeah.
So, and it's linked heavily to hormones.
Yeah.
So
a lot of estrogen.
A lot of estrogen, FSH, all that kind of stuff. So a lot of comorbidities that I see with those with lipedema are like Hashimoto's, Sjogren's, Ehlers-Down.
So some of the autoimmune things.
Yeah, a lot of autoimmune stuff.
Yeah. Well, we'll definitely do a separate episode on that. I think that would be great.
Yeah.
Well, this was amazing. Thank you so much. But before we hop off, can you share, one, about where people can find you if they're local and want to work with you? Sure. And two, if they're not local, where would someone go to find a certified lymphedema therapist?
Sure. Well, this has been lovely. Thank you for having me.
You're welcome.
I'm Magothy Therapy Wellness is my business. In Maryland, I'm located in Arnold. I have a clinic space, so I do all the things, lymphatic base. I have my medical line, and then I have my regular wellness line. So if you just want to come in for a wellness detox lymphatic massage session, I do that, 30, 60, 90-minute sessions. I have a vibration plate. I have a rebounder. So all the other complementary techniques in addition to what we talked about today. I also am online. So I have clients across the U.S.
Oh, great.
So I do virtual stuff.
Fantastic.
No, I can't do the actual hands-on virtually.
Yeah. But you can teach people, right? Oh, that's
cool. I train you, and I train you how to use all the different devices if you're interested, whether it's cupping, whether it's dry brushing, taping.
Oh, fantastic.
Vibration plate routines. A lot of people are like, I got this vibration plate. It's so great. I'm like, fantastic. What are you doing with it? And like, I just stand on it.
You're like, wait, you got to do some other things on it.
There's so much you can do.
Yeah.
So I do have clients across the U.S., so I do a virtual program. Yeah.
Great. Yeah. All right. So we'll put your links to website and everything. And then if people want to, if they want to find a therapist for massage, if they're not local, where would they go?
So there is the National Lymphedema Network. So they can search that, and there is a list of providers on there. There's also clt-lana.org, I believe. They can also find a certified lymphedema therapist through that website. So those are two really good, well-known websites where you can find a clinician that is a CLT that is closest to you.
Awesome. Yeah. Thank you so much, Kaitlin. This was
welcome.
A fantastic chat, and I hope everyone has a great week, and we'll see you next Monday.
Yes, thank you.
Thank you for tuning in today. If you enjoyed this conversation, be sure to connect with me on social media to find more helpful tips and information. You can find me at Dr. Kinney on all of the platforms. And please be sure to subscribe and leave a rating and/or a review. This helps grow the show so more people have access to this knowledge that leads to empowered healing. Love and light, and see you next week.